Hey everybody, welcome to Pick Dr. Osborne's Brain. Tonight we're going to be covering a topic that I think many of you should have a solid grounding on, or a solid ground of information, and that are some of the chronic creations or chronic triggers of inflammation despite the change in your diet. In essence, you've changed your diet and you're still struggling with inflammation. We're going to be going through some of the things that are very, very common triggers as it relates to that. And so before we get into that information, I want to know where you're from. So tell me hi, let me know where you're coming from. Make sure you send this message to a friend. So share this feed with your friends and family members. Let's get everybody educated together. But chime in and let me know where in the world you're tuning in from. Say hi, and we'll dive right into the show tonight. So let's see here. So inflammation is one of those things that, you hear the word, it's kind of this generic term. Everybody hears it, but, what does it actually mean? Inflammation is a normal process, meaning that inflammation is what the body uses to destroy or take care of damaged tissue. In essence, we turn on and activate inflammation inside our own bodies to destroy damaged tissue so that we can rebuild and replace it with new tissue. So inflammation as a process internally is actually a very, very healthy thing. It's not inflammation that's the enemy. It's chronic inflammation that becomes the enemy. It's when inflammation is too aggressive or inflammation is too exaggerated. Our body uses more inflammation than what it needs to take care of damaged tissue. And so there are a number of different things that can put your body into this state. And again, I want to get into those. So again, remember that inflammation is not evil. Inflammation is actually a healthy process. It's a good process. We want it to work for us, but we want it to work toward our advantage. So, again, I think it's important to have that conversation, that preface for what we're going to be talking about tonight. So it looks like we've got some of you tuning in now. Looks like the feed was a little slow tonight, but okay, here it comes. It's catching up. So Susan from Wenatchee, Washington, and Wanda from Tennessee, and Joshua from Pennsylvania, and Kim from Boston, and Janine from Pomona, California, Kelly all the way from Phoenix in the desert. Man, I am missing that warm weather right now. It's we had it in the 40s, and I'm a Texas guy. I'm used to warmer weather. Let's see here. We got Gail from Spokane, and Julie from South Florida, and Esther from all the way from the Southern Hemisphere, Buenos Aires, Argentina. Welcome, Esther. And we've got Linda from Saskatchewan, Canada. I hope I said that right. I think I said that right. Actually, one of my mentors, Abram Hoffer, one of my favorite doctors, he's passed away, but one of my favorite all-time doctors is Dr. Abram Hoffer from Saskatchewan, Canada. And then Misty from the Scleroderma group. Welcome back, Misty. Christy from Conroe, Texas, right in my backyard here. Ann from Laguna Hills, California. And Shelly right here from my backyard, literally my backyard, Sugar Land, Texas. And Natalie from Bunker Hill. Let's see here. Yeah, 90 degrees. Thank you for rubbing it in. Yeah, we're in the 40s right now. It was 42 when I woke up this morning. Amanda from Farmington, Missouri. Okay, so Susan, you're asking if I can talk about osteoporosis and its relationship to inflammation. Yeah, we'll bring that up because I think it's an important, it'll be an important part of this topic and conversation. So make sure you refresh that in the feed as I get closer to question and answer time. And those of you who have questions, again, make sure you plug them in. Let me know what they are. I want to do my best to get you taken care of tonight before we tune out. So if you've got questions, go ahead and start piping those in. And I'll do my best, again, to get as many of those answered tonight before we sign out of the show. So, all righty. Let's dive in. So, inflammation. We're talking about triggers of inflammation beyond the diet. So maybe you've already cleaned up your diet. You're gluten-free, you're sugar-free, you're dairy-free, you're grain-free, and you're avoiding foods and things that you're allergic to, but you're still struggling with chronic pain, chronic inflammation, And inflammation can rear its ugly head in a lot of different ways. For many people, that it manifests as pain. For some people, it manifests as hormone disruption or hormone abnormalities. For some people, the chronic inflammation can manifest in the skin. It can show up as different types of skin disorders like eczema or psoriatic type of skin manifestation, or even what's known as inflammatory acne or hyperfollicular keratosis, bumps along the backs of the arms. For some people, too much inflammation can look like they don't heal when they try to work out. Their bodies they don't heal and repair and recover. Or if they have an old injury, it just won't recover. It won't heal. It won't go away. Inflammation can be dementia. Inflammation can be brain loss or brain fog. Inflammation can also be liver inflammation, so your body doesn't do well with environmental detoxification. So again, a lot of different ways that inflammation can manifest it. When I say inflammation, I'm referring to chronic inflammation, not so much as the normal process of inflammation. So when the fire's too hot, when your body's using more than what it needs, or when your body's having to overproduce inflammation. So one of the biggest triggers or the biggest causes of persistent inflammation that I see is the omega-3, omega-6 ratio. So we're talking about how much omega-3 fat you're actually taking in through your diet. This is a very, very big one, because if you're most people who are coming from a place of poor diets and lots of grain and lots of sugar, lots of dairy, and lots of animals that are being fed grain. So if you're eating your standard feedlot beef or your standard feedlot chickens and things of that nature, understand that the quantity of omega-6 fats in your diet can be extremely exaggerated, extremely high. And we want an omega-3 and omega-6 balance. So when we're talking about omega-6 and omega-3, understand that omega-6 is not bad, it's not evil, but most people eat about 20 times too much of it, and that can create a persistent, heightened level of inflammation. So if you're thinking, where does omega-6 come from? For most people, it's in their grain and it's in their feedlot animals. So if you're drinking store-bought milk, if you're eating chickens, even the ones that are predominantly fed grain, even if they're free range, there's a lot of omega-6 in that bird. If you're eating non-grass-fed beef, there's a lot of omega-6 in that meat. If you're eating farm-raised fish, there's a lot of omega-6 in that meat tissue. So again, you're getting a heightened level of omega-6 fats. Nuts can be very, very high in omega-6. And so again, it doesn't mean you can't eat nuts. I'm not saying don't eat foods that contain omega-6 fats. I'm just saying don't eat unhealthy foods that contain an exorbitant amount of omega-6 without balancing it out with omega-3. So predominantly we get our omega-3 fats from fish and really cold water fish, to be more specific. Now, some of you may be thinking preemptively, I'm just going to answer the questions in a lot of your head, is that if I'm eating a lot of fish, do I have an increased risk for ocean water pollutants and toxicity of things like mercury? And the answer is yes, you do, but that doesn't mean don't eat fish. You have to understand, it doesn't matter what you eat, there's going to be something wrong with it in our modern society, in our modern world. I mean, unless you've got an ocean in your backyard that's, bubbled off from the rest of the world, unless you grow all of your own food and milk your own cow and own your own A2, genetic A2 cows that are only grass-fed, it's going to be really, really hard to control this, again, unless you own your own farm. So we don't want to panic about what we can't control, but we want to intelligently do what we can to improve our body's positioning. And so eating cold water fish like salmon and cod and halibut and mackerel and sardine and anchovy and tuna, that's a good idea. You do want to look for wild caught, and preferentially you want to buy from companies that have heightened levels of mercury testing. So again, you get an extra layer of protection or an extra layer of defense from that. But you do want to eat cold water fish because it's one of the predominant sources in the diet. Now, a lot of people will ask, what about flax and chia? Flax and chia don't technically contain the omega-3 in the EPA and DHA form. EPA and DHA are, let's think about these. EPA and DHA are the two active postcursors to omega-3 that are predominant for controlling and helping regulate inflammation. So eicosapentaenoic pentaenoic acid and docosahexaenoic acid, that's EPA and DHA. And so if you're eating flax or chia, you're not getting EPA and DHA. You're getting a different type of fat altogether that has to then be converted into EPA and DHA. So even if you're doing, so like those of you who are following a vegetarian diet, it can be harder to get your omega-3 levels up with vegetarian sources. And then some people will go toward algae or again toward the flax and the chia, and it just can be a very, very big challenge to get the levels high enough to really balance out a poor omega-6 omega-3 ratio. And so again, what is that ratio? What do we want that ratio to be? We want it to be 2 to 1. That means 2 to 1 omega-6 to omega-3. A 2 to 1 ratio is ideal, and it's going to help balance out your inflammation. Remember, we all make inflammation, but if you make more than what you need, your body has more damage done to it than what's necessary for normal maintenance and wear and tear. That can turn into chronic heightened inflammation, and that will actually cause you to burn through more anti-inflammatory nutrients to try to combat the diet being improper. So you'll burn through more vitamin C, which is an natural anti-inflammatory. You're going to burn through more of the plant botanicals that work as anti-inflammatories, things like ginger or turmeric or skullcap, or things that you might be getting in your diet that have anti-inflammatory properties like polyphenols and proanthocyanidins. These are plant-based antioxidants that have anti-inflammatory effect. So again, getting enough EPA and DHA to balance out your omega-6, omega-3 is very, very important. Now, I personally like this. I like to eat fish, but I just don't eat enough fish to do this. And so I take an omega-3. It's one of the few supplements I actually take on a very regular, very consistent basis, because I just don't eat enough of the fish. And also because I want to take something that has had that I can ensure that there is no mercury. So there's a distillation process, and there's a molecular removal of any type of contaminants in a high quality fish oil supplement. So I can still get that omega-3, concentrated omega-3, without having to worry about some of the ocean water pollutants and contaminants. So again, that's something that you might want to consider if you're not already. Let's see here. We've got a question coming in. I want to make sure I answer it. Well, actually, I'm going to get to that in a minute. I'm sorry, I'm delaying here, but I want to answer that in a little bit more in context here in just a moment. We got Jamie tuning in from snowy Michigan, so I really feel sorry for you guys. Let's see here. Patrice Lowe's. My blood showed inflammation. I have an underactive thyroid. Feel terrible aching joints, so tired and overweight. Help advice needed. My doc got me on beta blockers and Prozac. Boy, you know, I hate to say it, that's not going to fix your inflammation in your aching joints. Beta blockers aren't going to fix that. Neither is Prozac. Now, beta blockers are designed actually to lower, for many people, lower blood pressure. So I would imagine then with your overweight status, you might have an elevation in your blood pressure. You know, if you're looking for root cause origin of inflammation and you haven't already changed your diet, and if you're overweight, the likelihood that you haven't changed your diet is probably pretty high. What I really recommend is get you a copy of No Grain, No Pain. Now, this book I wrote, for people who didn't have specific laboratory testing, if you're not working with a doctor who's running the right kind of lab tests, I wrote this book for you because if you start following the protocols, especially in chapter 7 and chapter 8, it's going to get your weight down. It's going to get your blood pressure down. And just by default, it's going to help you start reducing the inflammation with your diet. But if we're talking specific nutrition, there's some things that I want to talk about on that. And so I'm putting up an image here. You can see this is an image that basically titled Drugs That Cause Gut Dysfunction. I think it's a very, very important thing to understand that many of you that have been put on medications, your doc's saying, look, let's just put you on some drugs to mask your symptoms. And that's maybe not what he's saying, but they're saying, let's put you on some medicines to treat your problem, when in reality, what they're doing is putting you on medicines to mask your symptoms and give you a false sense of security and a false sense of confidence that the problem has been addressed. The reality is that many medications can actually, over time, make the problems worse. And so many medications actually cause gut dysfunction, which can lead to malabsorption, can lead to nutritional deficit. And this is actually one of the big triggers of persistent inflammation. It's nutritional deficiencies. And I want to talk a little bit about that tonight, because I think the topic itself is crucial in understanding if you have nutritional deficiencies that are being caused by your medications, you'll have a very, very hard time ever overcoming the inflammation. Especially, I'm going to give you some examples. Many of you may be taking medicines for your gut, like to reduce, for example, gastroesophageal reflux disease. So you're taking something that blocks acid, and when you block acid, you also block vitamin D and vitamin A and calcium and zinc and chromium and copper and vitamin A. And what you actually end up when you block those things, you end up with a heightened inflammation, because your body needs those nutrients to combat and to deal with inflammation. So when you're taking a medicine that actually causes malnutrition of nutrients that are important inflammatory regulators, you can actually end up with more inflammation. And what you just mentioned a minute ago, Patrice, is that you're on a beta blocker. Understand that beta blockers can affect CoQ10 and zinc. Now, CoQ10 and zinc are both anti-inflammatory. They're both antioxidants. They both play a role in how you drive and generate energy from the food that you eat. So being deficient in them causes chronic fatigue. Being deficient in them also, though, causes muscle loss. So without CoQ10 and without zinc, you could start to develop muscle atrophy or muscle loss. And that can lead to more weight gain, because the lower muscle mass you have, the easier it is to gain weight. And then it makes it harder to exercise. And, when your muscles atrophy and they shrink and they compress, you've got painful joints as a result of muscle atrophy. You've got more weight gain as a result of muscle atrophy, and it becomes a vicious cycle. So, I mean, really, to get to the core root of to answer your question, go back and read No Grain, No Pain, and really have that conversation with your doctor about, the principal purpose of what those medications are designed and what they're trying to do, what they're trying to accomplish for the rest of your life, because they're not a lifelong solution. They're a short-term mediator, but you need a lifelong solution, and that just isn't going to cut it, in my opinion. Let's see here. So so let me pull that image down. So again, nutrient deficiencies and drugs that cause gut dysfunction, because if your gut's broken and you're trying to eat food and that food's not being properly absorbed and those nutrients aren't properly being absorbed, you're going to end up with an increase in inflammation as a result of nutritional deficit. Probably one of the most potent and essential nutrients that we need that we don't get enough of, or that we need more of, is vitamin C. And again, without vitamin C, vitamin C is a natural anti-inflammatory. Vitamin C is also a natural antihistamine, so it helps you fight allergies. It's also a fuel source for your immune system. So vitamin C actually fuels and feeds the immune system and helps it to do its job properly. So vitamin C deficiency can create a whole lot of problems. And couple that with vitamin C's role and function in creating new collagen. It's necessary to form the backbone crosslinks in collagen, which make your collagen super elastic and stretchy. Now, those of you who don't know what collagen is, it's the elastic protein that helps form the basis of your skin structure and your bone structure. So going back to the question about osteoporosis earlier, is that you need vitamin C to form strong, healthy, resilient, and elastic bones. You need it to make healthy skin. You need it to make healthy blood vessels. You need it to make tendons and ligaments. You need it to make healthy cartilage. And so again, if you're using a medicine that interferes with the vitamin C as a process, then you're going to end up in a tight spot. You're going to end up in trouble. Okay. Some other, again, so nutritional deficiency, I want to put up an image for you, because this, if you look at this image, what this is saying, if those of you who are watching, many of you probably already know you have gluten sensitivity, and many of you may not know, but do have a gluten sensitivity. This is coming from a study that was published in the journal Nutrients. 87.5% of people diagnosed with gluten sensitivity were deficient in at least one nutrient. 53.8% deficient in two nutrients. 7.5% were deficient in vitamin A, 14.5% deficient in vitamin B6, 20% deficient in folate, almost 20%, 19% deficient in vitamin B12, 67% deficient in zinc, 46% had iron storage deficits, 32% had anemia, which is caused by nutritional deficiency. And the problem, even in this study, the problem with this study is that this study only evaluated certain nutrients. It only evaluated a handful of nutrients. You have your body, there are 40 different essential nutrients, meaning there are 40 different nutrients that your body needs to eat to be able to function and be healthy. And this study that was done and published showed that, people with gluten sensitivity were at risk for vitamin and mineral deficiencies based on certain testing. But, the part about this is not all nutrients were tested for. So in this particular study, these authors of this study didn't test for vitamin B1, B2, B3, B5, B8, vitamin C, magnesium, calcium, potassium, copper, selenium, chromium, iodine, vitamin K, vitamin E, or essential omega-3 fatty acids. So this study, even though it shows that a lot of people with gluten sensitivity have a high preponderancy toward nutritional deficiency, the study is somewhat misleading because it didn't test all the nutrients that are important to be tested for. And so probably the reality is that the numbers are much higher than what this study even shows. So again, the study is misleading, potentially not showing that the problem is as great as it actually is. So, and again, that tells you where the positioning is. So if you've got any history at all of gluten sensitivity, you've been eating gluten your whole life, the reality is if you have been doing that and you are gluten sensitive, the likelihood that you're going to have mass scale nutritional deficiency is very, very high. And again, going back to what creates inflammation, what are we talking about tonight? In my experience, one of the biggest reasons for persistent chronic inflammation is nutritional deficiency. Again, vitamin D deficiency can cause chronic inflammation. Vitamin C deficiency can cause it. Zinc deficiency can cause it. Magnesium deficiency can cause it. So we've got remember, these nutrients have multiple biochemical functions within the body, and many of these nutrients regulate the inflammatory cascades, regulate how our body produces inflammation, regulates the quantity of inflammation that we produce. So again, if we're low in nutrients, and nobody's even testing us for that, nobody, if your doctor has, well, I like to say, if your doctor's got his head in the sand and he's just saying this isn't important enough to test, and I actually had couple of people here this past week come in to see me. One person came in. I requested a bunch of lab tests. She went back to her primary doctor, and that doctor said these are not important tests to order at all. So she had to actually go get these lab tests done through a different lab testing service, and came back. All the lab tests that I ordered were abnormal, even though her doctor said they weren't important, and they gave us vital insight and clues as to what to do next. And so it's one of those areas where, again, a lot of times the doctors they keep their head in the sand and they say nutritional deficiencies. What is that? I'm not really trained in that. That's not important. We're not going to look at that. Or the way they look at it, which is a lot of doctors will measure serum nutrient levels, which is not a very accurate way to ascertain nutritional deficiencies. And they don't go any deeper than that. And sometimes people are kind of left with their shoulders shrugging. What do I do next? Because it looks like everything is normal. You got to have the right kind of nutritional testing done. And predominantly speaking, when it comes to vitamins and minerals, some of the best testing to have looked at, look inside either the red blood cells with red blood cell testing, or look inside the lymphocytes. It's called lymphocyte proliferation testing. These types of tests are the most accurate ways to ascertain chronic nutritional deficits that can heighten your body's inflammatory state and make it a lot harder to heal, repair, and recover. And so it's important to know that, because if you are suffering with malnourishment, you don't even know it. You don't know how to supplement. You don't know how to change your diet. You don't know what foods to eat more of to get more certain nutrients to correct that. And one of the problems I see on a very, very regular basis is another one is iron deficiency. I see iron deficiency. Many people with chronic gluten sensitivity have had so much damage to their intestinal tracts that they've got internal bleeding that's happened. So they've lost iron through occult blood loss in either from their stomach or their small intestine, and they've developed severe iron deficiency, and nobody's checked them for it. Nobody's looked or measured to see where they're anemic, and they're tired all the time and they hurt all the time. And iron deficiency causes, one of iron's functions is that it helps to form a molecule called hemoglobin, which is a protein that carries oxygen through your body. And if you don't have adequate iron to do that, you can't get oxygen to your tissues, then your tissues start to generate energy through what's called anaerobic metabolism, which leads to pain. And that subsequently can lead to and contribute to heightened sense of pain. And from there, a person becomes tired and lethargic and they hurt all the time. So then they start gravitating toward medicines that fight and combat pain. So whether it's an opiate medication or whether it's, something less aggressive, like Tylenol or an ibuprofen or a non-steroidal anti-inflammatory or even an aspirin. And in some cases, some people jump and gravitate toward even more aggressive things like steroids. Understand what I was talking about earlier is that many of these chronic pain medications can actually damage the gut, damage the liver, cause bone loss, cause nutritional deficiencies that, again, can hinder this problem and make it even worse. So we end up getting stuck in this catch-22 type of scenario. So again, you want to make sure that you're working with your doctor and you're demanding that they check your nutritional status to get you properly evaluated. Because again, if we're trying to isolate and identify why the inflammation is there, you certainly want to know why and not just that it's there. So many people get a test done. There are a couple of different screening tests for inflammation. One is called ESR, and the other one is called CRP, C-reactive protein. And I'm going to put this up on the board for you. So ESR is erythrocyte sedimentation rate, and CRP or C-reactive protein. These two are blood markers or blood tests that measure for inflammation. A lot of people come back, their doctors run these tests. They say, hey, we ran these tests, you're inflamed. And then the next step is they want to put you on an anti-inflammatory. Well, it's not that you're inflamed. We know that you're inflamed with these tests, but it's why is the inflammation there? What is causing the inflammation is the bigger question. Not that you have it, but what is actually causing it. Because if we can figure that part out, if you know what's causing it, if it's something that you're eating, if it's something that you're not getting, if it's a nutrient that you're not getting, if it's something else, right, that can be discovered and dealt with, then that's what we want to know, because that's where the meaning is. That's where the true meaning of actually getting better will come from, not from here's a steroid to block that, or here's an immune system suppressant to block that, or here's an ibuprofen to block that. We don't want to block it. We want to find out where it's coming from. Blocking it, again, it gives you a false sense of security. It may make you feel better temporarily, but with that feeling better, it allows you to continue to do the things that potentially are creating the inflammation in the first place. So you really want to understand where it's coming from. So again, those tests are ordered and looked at commonly by docs to ascertain if there's inflammation. But the bigger question is, if there is, where's it coming from? And what I'm trying to tell you tonight is that one of the biggest sources of hidden inflammation that is repetitively, in my experience, that doctors fail to investigate, fail to look at, is nutritional deficit, nutritional deficiencies. I'm going to show you another example here. In this example, this is vitamin B12 deficiency. Now, one of the things that happens with a vitamin B12 deficiency is you can get an elevation in an inflammatory chemical called homocysteine. Homocysteine in and of itself can cause an inflammatory response. And one of the only ways to treat homocysteine elevations is through vitamin B12. And if the doctor never even looked at your vitamin B12 or never even looked at folate, can also do it, vitamin B9, which is folate. Folate and B12 and B6 all help lower homocysteine. They're actually the only three things that really can effectively lower homocysteine, and none of them are drugs. So they're all vitamins. And this, again, if you have elevations in homocysteine, now we go back and we say, okay, well, what's causing it? Is it a B12? Is it a folate deficiency? Is it a B6 deficiency? Are there methylation gene abnormalities that you have that are contributing to this? Again, we want to know the why. So again, this is just an example. B12 deficiency can cause hyperhomocystinemia, which is elevation in homocysteine, which can lead to inflammation. But B12 deficiency can also cause oxygen deprivation because you need B12 to form healthy red blood cells. And so if you don't have adequate B12 to do that, you're going to be oxygen deprived, and that in and of itself can cause inflammation. So again, there are multiple mechanisms at work. One of the other functions of B12 is it's known as a lipotropic, meaning it helps the liver process fat. So if you're B12 deficient, you can actually develop fatty liver disease symptoms. So again, one vitamin, multiple different mechanisms and multiple different ways as to how we might develop an inflammatory response around one vitamin deficiency. And again, if you're working with a doctor who's not even measuring a vitamin at all, they're not even measuring nutrients, you've got 40 essential nutrients that should be measured in order to help you ascertain how your body is regulating the inflammatory process. And if none of that's being looked at, you're never really going to probably find that solution to why that inflammation is occurring in the first place. So, again, very, very critical, very, very important to look at that. And I'm going to talk about another nutrient that I see very, very frequently, very, very commonly, and that's magnesium deficiency. Magnesium is, again, it's a mineral. It's extremely important. It has about 300 different functions in our bodies, biochemical functions. Some of them do regulate inflammation. Some of them regulate neurotransmitter production. Some of them regulate how we build our bones. Some of them regulate immune function. Some of them regulate how we generate energy from carbohydrates. So there's just a lot of different functions for magnesium. I mean, there are textbooks written on the topic of magnesium and magnesium deficiency. So we won't drive into all of that tonight, but I want you to understand that many people suffer with magnesium deficiencies, and that actually is the source of their inflammation, is the magnesium deficiency. So again, if you struggle, especially if you struggle with a chronic pain type of condition, magnesium deficiency is one of those that is commonly associated with that. Muscle spasms, muscle tightness, chronic joint pain. We see a lot of magnesium deficiency. And again, I think it was Patrice that asked earlier about blood pressure. She was on a beta blocker, and understand that magnesium deficiency can cause high blood pressure. So if you were put on the beta blocker, but your doctor never measured your magnesium levels, you still don't know why your blood pressure is high. And that, again, there's a disease or a condition in pregnant women called preeclampsia, which is basically high blood pressure pregnancy. And the way it's treated in the hospital is through magnesium IVs. In essence, that's how we treat pregnant women with high blood pressure. So, how many times have you heard of a person going to the doctor? They were put on a blood pressure medicine, but their doctor never measured their magnesium, never even thought to look at it. Again, magnesium deficiency all by itself can cause high blood pressure, but among other things. But part of what we're talking about tonight is that inflammatory response. So again, you should thinking about this. How can you apply it? How can you apply? What are we going to go do next after we listen to this tonight? If you're dealing with a chronic inflammatory disorder and you're on medications that are designed to be treating that chronic inflammatory disorder, but your doctor has never looked at your nutritional status, this is the walkaway. This is the take home tonight. You really want your doctor going back and doing a very thorough and adequate nutritional workup on you so that he can isolate and help you identify what nutritional deficiencies you might have. So either one, he can allow you for supplementation, meaning putting you on nutrients, supplements that will help address those deficiencies. Two, help you change your diet to incorporate foods that are going to contain more of those nutrients. Or three, ask an even potentially bigger and deeper question, which is, depending on how many nutritional deficiencies you have, why do you have so many? Is your diet inadequate? Is your gut broken? Do you have gut inflammation? Is your gut on fire? And that's why you're not absorbing these nutrients. And if that's the case, that opens the door to look at more and additional types of things. It opens the doorway to let's look at your gut. Is it inflamed? Is your gut malabsorbing or maldigesting? Is the gluten damaged your gut to such an extent that you've got scar tissue and damage to your gut lining in certain areas of your small intestine that absorb certain nutrients? And so you're at risk forever for nutritional deficiencies because of that scarred tissue or that damage. These are things that you should be thinking about. These are things really more specifically that your doctor should have been thinking about and should be informing you about. So if this isn't the conversation that you're having, I highly recommend that you go chat with your doctor about having that conversation, because without it, again, you're going to struggle. And I hate it when people have this scenario where they're chronically struggling, not because they need to be, but because they just haven't had somebody go through the process of due diligence and really be well enough investigative with them. Okay, let's see here. Looks like we got Nancy chiming in from Georgia. Hi, Nancy. Boy, the questions are flowing in. So again, those of you who are just tuning in, let me know where you're from. Chime in and make sure you type in your questions. And again, I'll get through as many as I can. We got Marie tuning in from Toronto, Canada. Welcome. Let's see here. So let's get to some of these questions. Boy, I'm going to have more than what I have time to answer, I think. Julie Young, how do I feel about activated charcoal? Activated charcoal is great. Look, it's used as a binding agent, particularly in the gut. If you've got an inflammatory process going on in the gut, and you're trying to deal with that. Charcoal is not an anti-inflammatory, so it's not going to fix that. But let's just say, one of the classic examples of using where somebody might have charcoal or be using charcoal is if they have an infection in their gut and they're being treated with an antibiotic or an antibiotic botanical, and there's a die-off reaction. And so what charcoal can help do is bind all those bacterial toxins and prevent them from kind of leaking through into the bloodstream, and can bind onto them and help you kind of wash them out or push them out. So that's where activated charcoal can be an effective agent. Not everybody needs it. Not everybody should run out and start taking it, but it can be effective that way. Misty's asking about my experience with people with scleroderma. Look, with scleroderma, the couple of fundamental things. Number one, diet change is imminent and necessary. My experience in dealing with people with scleroderma has really been mixed in this sense. Many people come to me and don't realize that I'm going to ask them to change their diet, and so then they get scared and they go away and they continue to suffer with their illness and continue to need things like steroids and immune suppressants to deal with it. But on the other flip side, those ones that I see that change their diet, and I've never met a patient with scleroderma who didn't have a gluten sensitivity issue. I'm not saying that it doesn't exist, but gluten, in my experience, has always played a role in the progenesis of scleroderma as the autoimmune disease. Those of you who don't know what scleroderma is, it's a form of autoimmune disease that can affect soft tissue. But I also see a lot of nutritional deficit in these patients. Nutritional deficiency is a very, very common thing that with scleroderma is present. And so, again, everybody's unique and different. I like to look at autoimmunity from the initial foundational glasses of, we've got to rule out vitamin and mineral deficiencies. We've got to rule out any types of infectious pathogens, bacteria, yeast, fungi, parasites, etc. We've got to look at the potential problem revolving around food, and gluten is one type of protein found in food, but there can be other food-based triggers as well. And then you got to rule out other chemical exposures. Heavy metal exposures are not uncommon in these types of individuals, and mold toxicity is not an uncommon thing in these individuals. So hopefully that helps give you at least a small window into my experiences there. Okay. And I haven't had a super high inflammation, CRP, and SED rate. I found out that I had super high levels of mycotoxins. I have 2 mold genes where I don't detox them on my own. Got the mold toxins almost gone. I have high levels of heavy metals, working on it now, EDTA chelation, gone gluten-free. How dangerous is it to have such high levels of inflammation? Will my body be okay when I get it under control? I am concerned of the damage it can cause, but it will take a while to get down, doing all the right things. Yeah, okay. It sounds like you've had somebody doing some intelligent exploration with you. So, understand you can never go into your healing process with I'm going to use maybe a stronger word, but a fatal type of attitude. Not that your attitude is fatal. It sounds like you're actually on the upswing and quite positive. But what I mean by that is some people think, okay, because I have eye inflammation, I can never get it better. I can never overcome it. And that's just not true. Your body will regulate it once you figure out what's creating it. So it's like I said, it looks like at least you're working with somebody who has some knowledge of some more advanced type of environmental illnesses that can trigger inflammation. I mean, it's very rare that you hear somebody say, my doctor checked me for mycotoxins or mold toxicity, but that was a smart thing to do. Or checked you for heavy metals. That was also a smart thing to do. So I would say, sounds like you're in good hands. Keep working with your doctor there, and just stay positive. And what you should be noticing, at least in my experience with these types of things, is persistent, consistent improvements along your period of time. Okay. Let's see here. what are my thoughts about supplementing with DHA derived from algae? Look, I prefer supplementing with DHA derived from small fish, because you're not going to, in most algae supplementation and algae itself, you're not going to get the quantity of DHA that you're going to get out of fish or a fish oil. It's a dosing issue. Think of the analogy as maybe trying to spit out a forest fire. The quantity of spit that you can produce is nowhere near the quantity of liquid that's necessary to put out a forest fire. And it's a lot like that with using algae as a supplement for trying to overcome a DHA deficiency. Okay. Karen is asking, where do you get your book? I have fibromyalgia. Any thoughts? Lots of thoughts on fibromyalgia. Fibromyalgia depends on whether or not you've got an accurate diagnosis. A lot of people have been told they have fibromyalgia, but actually don't. They have something different. I'm not saying that's your case, but where you can get my book is No Grain, No Pain book.com. If you buy it and actually that you can't buy it there, but you can put your receipt information in that website, and I'll send you also a free leaky gut guide. So No Grain, No Pain book.com. You can buy it at any major outlet, Target, Walmart, Amazon, Barnes and Noble. Any of those you can get it from. And if you go to No Grain, No Pain book.com, you'll see a link to a number of the major sites who actually carry it. You can pick it up that way. Let's see here. So Sharon is asking, what blood tests should I ask my doctor to test so all my levels are tested, corrected, to check there are several, Sharon, several different kinds, and they're not all blood tests. Ferst of all, you want to ask him to measure your nutritional status using lymphocyte proliferation. You want to have him measure your iron and have him do an iron panel and a ferritin. You want to have him run what's called a CBC, a complete blood count with chemistry. You want to have him run what's called an iodine loading test, because you want to measure iodine. You can't measure iodine, is not measurable through lymphocyte proliferation, and it's not all that accurate to do it through plasma levels. You also would like him potentially to run red blood cell levels on your magnesium. You can have him run your homocysteine level, which will be an independent or an indirect marker for B12, folate, and B6 and B2. So again, it's a lot of different types of tests. I think the bigger question is, ask your doctor that you're seeing if they're versed in nutrition. That's really a bigger and more important question. You don't want to go to your doctor who has no training in nutrition and then trust them as a professional to be the one that's measuring that. You want to really find a doctor who's qualified, let me rephrase that, who's not just qualified, because a medical doctor by law is qualified to run these things, but just because they're qualified doesn't make them capable of understanding and capable of interpreting the result with any great degree of experience or accuracy. And so it's not an issue of qualification as much as it's an issue of, are they trained, and is this their specialty or their level of expertise? So my advice would be finding somebody who's trained in functional medicine or who's trained in nutrition. So a couple of different places you can look. Go to Functional Medicine University and you can look up their doctor database. You can also look Institute for Functional Medicine. You can look at their doctor database. You can also go to acbn.org, acbn.org. That's the American Clinical Board of Nutrition. It's actually, and that's part of what my delineation is. I'm a diplomate with the American Clinical Board of Nutrition, and in my opinion, it's one of the preeminent ways that a doctor can get postgraduate training in clinical nutrition and have the most and the strongest knowledge base, in essence, on when we're talking about nutritional testing. So really, I would say if you're looking for the cream of the crop, look for somebody with the ACBN delineation behind their name. DACBN would stand for Diplomate American Clinical Board of Nutrition. Good question. Josh is asking, and this is a generalized question: how long will it take to heal the gut once supplementing and supporting nutrient deficiencies? It depends. I mean, remember, the gut can heal relatively quickly. For most people, the gut has a turnover time of approximately 2 to 7 days. So the gut has the capacity to heal well. It just depends on what you're putting in it. So maybe you have nutritional deficiencies, you can supplement with those. But if your gut is inflamed for a different reason, if you are eating the wrong foods, or if your diet's not dialed in, then you can have persistent ongoing inflammation that supplementation is not going to really do a whole lot for until you get your diet dialed in. So it depends. I mean, I like to say, we need 2 to 7 days for the gut to turn over, and that's in a healthy gut. But if we've got a diseased, inflamed gut, it's going to take a lot longer. And for many people, 6 to 18 months is a good kind of reference or time range. But a lot of that just depends on a lot of the variabilities that could be who you are. So Joshua, as who you are, there are variables in your life. Do you exercise? Do you get sunshine? Do you sleep? Are you under a lot of stress? What kind of diet are you following? Are you getting processed foods? Are you getting GMOs? Are you, there are those variables. And so in clinic, that's what we call the variables of understanding how quickly or how slowly somebody's going to respond. And so a lot of that is important for me to understand about a person before I can just give them a generalized time frame, because those variables matter, and they matter big time. I don't know what the question in this is, Gwen, but ankylosing spondylitis with HLA-B27, is that a question, or is that are you just stating that that's what you have? Many people that are struggling with AS, which is a form of autoimmune disease that can affect the spine and the joints, are HLA-B27 positive. And in my experience, those people with HLA-B27 positivity do better when they're avoiding nightshades. So again, if you haven't read No Grain, No Pain, the nightshades are a family of vegetables and produce in general. So nightshades generally include potatoes and tomatoes and peppers and things like eggplant and goji berries. But nightshades can flare up, in my experience, ankylosing spondylitis for people who are HLA-B27 positive. Cindy saying hello from Donna, Texas. Hi, Cindy. Nice to have you on tonight. So Jan is chiming in on the Dirty Genes Summit. Dr. Lambert and Lynch mentioned it's a waste of time to gene test without first doing an oat. Is this relevant for the gluten gene test that you offer as well? No. And I understand exactly what Dr. Lambert and Dr. Lynch mean when they say that, but no, it's not relevant for genetic testing with gluten sensitivity, because you either have the genes for gluten sensitivity or you don't. So if you have gluten sensitive genes and you eat gluten, you will activate those genes to produce inflammation. It's not dependent on anything other than exposure. So you certainly want to know whether or not exposure would create inflammation for you. And that's where you really want to dial in and just know whether or not you have those gene markers. Let's see, Karen asking, how do I get to talk to you? For those of you who want to get kind of more in depth with consultation, you just have to call my office, and I'll just pump that number up on the board for just a minute for you. You can do that. You can call my office, and you can get a consult with me. Let's see here. Marie, I heard that Manuka honey helps treat gut bacteria. Is that true? And being on an inflammatory diet, my naturopathic doctor has had me on a liquid supplement also to help. Just wanting I'm not sure I understand what you're saying there, but anyway, I think I'm going to try to make a best guess at it, Marie. Manuka honey is antibacterial and antifungal. It actually can be very, very effective, although I don't know that I would use it as a treatment. I might say we could use it as a preventative, but I don't know that you could necessarily use it as a treatment, at least not in my experience. I would say if you have an infection of gut bacteria, then the most important thing to do would be to have your doctor run a test that isolates and identifies what that infection is. In essence, what species of bacteria are you dealing with? And then from there, do a sensitivity test to measure how to kill that bacteria. because there are a number of different botanicals that can be effective, but whether or not they are effective will be dependent upon the bacteria in you. For example, some people have Klebsiella in their guts, Klebsiella overgrowths, and for some people, berberine as a botanical might be effective, but for others, their Klebsiella is not responsive to berberine, and that's different from person to person. So it's really more important not to take a broad spectrum as it is to take something that has been more targeted for what it is that you have as a unique person. Charlene Charlene is chiming in from Santa Cruz, California. Hi. Let's see here. Let's see. Question. How does osteoporosis relate to the autoimmune process? And are there some additional specifics that will benefit? Not quite sure I understand that question fully. Osteoporosis is now being identified as an autoimmune process. So it's understand that your bone is regulated by specialized types of cells that evolve from your white blood cells. So your white blood cells, when they're born in your bone marrow, before they've differentiated, become different types of white blood cells. Some of them will go on to become what are called osteoblasts, a specialized type of bone building cell. Some of them will go on to become osteoclasts, a specialized type of bone degrading cell. And so generally what we want with osteoporosis, we want a balance between osteoblasts and osteoclasts. But what can happen is you can actually create in osteoporosis, in autoimmune osteoporosis, you can create antibodies against some of the proteins that are important for building your bone. One that was identified a number of years ago is called osteoprotegerin, which is a protein that if you develop antibodies against, you can actually develop aggressive autoimmune bone loss. So that there's a relationship between autoimmunity and bone loss, because the bone building and the bone breakdown cells are they're differentiated cells from your immune system. So again, there's a whole field of science. If you want to look this up and learn more about it, it's called osteoimmunology. And it's a whole field of science. It's just blowing the doors off of what people think about osteoporosis. So that's what I would really recommend that you look more into in terms of osteoporosis. Wow, this is kind of a different question, but do I fire my patients who do not eat according to my dietary standards, and how do you handle someone that's trying to be compliant but slips? Look, I'm not. I don't fire people who don't eat according to my dietary standards. I fire people who aren't, because my dietary standards, if you don't want to follow what's in my book and you're in my office and I failed to test you or get to differentiate what it is you need to avoid, that's on me. That's my fault. How can I fire you if I'm not doing my job? However, if I run testing on you and I isolate and identify that you should be avoiding certain foods and you're just not willing to change your diet, then there's no more. Yeah, I would release you from care, because there would be no point in continuing a relationship where you're not willing to listen to your own biochemistry. There's nothing I can do for you. If you can't help yourself, how can I help you? But I just don't guess about the difference between what I do and what a lot of other doctors who claim to be like me do. And I'm not saying this about all of them, because there's a lot of good doctors out there, is that I actually differentiate very objectively through scientific measurement, as opposed to just saying, try this for 6 weeks and let's see what happens. Guessing is by the time somebody comes to me, the guessing work is done. We're going to become very, very objective. So that kind of is the way I like to think about it. Now, as far as somebody slipping, look, I can forgive. Everybody slips. Nobody's perfect, including myself. So it's one thing to slip. It's another thing to do something completely on purpose. So if you know you're gluten sensitive and you go indulge at a pizza shop, that's on you. And that's just foolishness. The difference between ignorance and stupidity is an education. What I try to do with people that come to see me is educate them so that they don't make uneducated decisions. They make informed decisions, because nobody wants to be stupid, but being ignorant because you don't know better is a completely different matter. Good question. Let's see here. I have been gluten-free for 17 years. However, found out I have not been the last few months. Some of the things I have been ingesting were not because of hidden glutens, corn and rice. I'm not quite sure. Okay, I hear what you're saying. I think you've been gluten-free, as in you've been wheat, barley, and rye-free for the last 17 years, but recently found out about the glutens in corn and rice, and so you feel awful going off of them because you're detoxing. Give it a couple months. For some people, the withdrawals can be pretty nasty, just like a drug withdrawal. But for most people, that's going to, again, for most, in my experience, it's going to pass within the first few weeks. Where it doesn't pass, there may be some missing pieces of data that you really need to get analyzed and looked at, Aaron. So again, that would fall into the category of getting with somebody who's an expert in functional medicine who can really, really help guide you along those lines. Penny's asking, what's the best kind of, I'm going to assume you mean magnesium. There it is. What kind of magnesium? There's not one best. And understand that different people are different. So there's magnesium citrate and glycinate and gluconate, and there are a number of different forms of magnesium or magnesium chelates or magnesium salts. And it's not that one is absolutely the best. There's different ones are used for different reasons. For example, if somebody's having trouble sleeping, magnesium threonate is a better option because it passes the blood-brain barrier, and it can start to activate some of those enzymes important for sleep regulation, whereas a traditional magnesium citrate won't pass that blood-brain barrier as effectively or as readily. Some magnesiums are good for if you're talking about constipation. There are certain ones like magnesium citrate can work really, really well for constipation, whereas for blood sugar regulation, hyper and hypoglycemia, magnesium gluconate can work very, very effective and very well for that. So there's not a best. Don't think of it in terms of best. One of the reasons that one of my formulations, Ultra MG, has 4 different types of magnesium in it is because if you're just buying a magnesium supplement and you don't know which one's best for you, we're going to get you one of the types of magnesium that's going to be effective in you because it contains multiple forms. So that, again, it's not an issue of one's better than all the others. It just depends on the use, what you're trying to accomplish with that magnesium. Let's see here. So this is a really long question, but so I've been tested for vitamin D. It looks like the level is high at 256. CRP at 1.1, which is borderline high. Magnesium 0.93. Hemoglobin 124. ESR. Okay, I'm going to skip the numbers. Looks like you've been tested for several things. You're on folic acid, which I don't recommend. Folic acid is a synthetic folate, and it has linkages to cancer. I'd recommend a folate, but not a folic acid. Fosamax, CoQ10, magnesium, vitamin D3, calcium, K2, B12, vitamin C, and mostly a vegan vegetarian diet because you can't get quality meat here. I try to avoid nightshades. I had targeted probiotics to replace missing gut bacteria. The thing is, my RA is considered in remission, but my osteo is causing inflammation. And my IBS still bothers me. I can't tolerate the brassica family. I'm normal weight, exercise daily, and move throughout the day. Why would one disease be stopped but the others keep going? Because the issue here is everybody's entitled to more than one problem. So everybody listening tonight, write this down. You are entitled to more than one problem, and you're entitled to more than one cause, or more than one contributing factor for an illness. And so you may have changed certain things and done really well and gotten certain aspects of your health problems under control, but still struggle in other areas. And part of that can be lack of specificity. So lack of specificity as in you're missing key points, you're missing key triggers. Nobody's investigated key triggers with you or done the full comprehensive approach at looking at the different key triggers. So you're still missing something that's contributing to a persistence in symptomatology. And that's a very, very long question and a very roundabout answer to it, but I can't give you more details, specific details, without doing a full case review on you. Sharon is asking, I've had gluten testing and celiac disease testing and nothing showed, but since testing my own body's response when taking out gluten foods, I've had huge changes in pain and reduction in bloating. Well, okay, so this is where, again, if those of you who haven't read No Grain, No Pain, understand that when you're gluten-free, you're not just gluten-free, you're cutting out molds and mycotoxins, you're reducing omega-6, omega-3 fatty acid ratio, you're actually reducing your exposure to glyphosate, the pesticide. So you may not be gluten sensitive. You may just have a problem with some of the other things that are commonly found in grains that can also cause gluten-like symptoms. If you've had gluten testing, I would say it depends on the kind of testing you've had done, because many people think they've had gluten testing, but what they've had is gliadin testing, and it's not the same thing. Same thing with celiac disease. You can be tested for celiac disease, but the test can be highly inaccurate. In essence, there's a high preponderancy toward false negative test results with celiac tests and gluten sensitivity testing. That's why the most accurate way to look at it is through genetics. You can't trick your genes, and your genes never change. So if you have gluten sensitive genes and you eat gluten, you're going to react to gluten. And again, that's it in a nutshell. Get properly tested if you haven't already been, because you may not be gluten sensitive. You may just be reacting to some of the other things that are commonly found in conventional grain. Are a functional medicine doctor and nutritionist equally as knowledgeable with blood testing and nutrition health? Do you recommend one over the other? Look, it's hard. It's one of those areas where, let me give you an example, Melanie, because I know this is a tough one. If you ever hired a plumber, I don't know, many of you may have hired a plumber to come out and fix, a broken toilet or a broken sink, and maybe you hired one that wasn't so good. They still had a plumbing license, but they came out, they didn't really fix it. They did a bad job. You wouldn't recommend them, and you wouldn't hire them again. Then you hire another one over here who's got the same exact certification. They come in and they do a bang-up job. They do a fantastic job. They're in and out, no time flat. They don't charge you as much, but they actually fix the problem. They both have the same license. They both have the same minimal level or criteria level of education, but one was just actually better. That's a reality in life, and that you may find a functional medicine doctor who's trained but doesn't have experience, and it's just not really good. As a matter of fact, I had somebody this morning told me that their local doctor, the reason they quit seeing their local doctor who was trained in functional medicine is because they didn't practice functional medicine. They were trained in it but didn't practice it. And the reason they said they didn't practice it is because insurance didn't cover it, which doesn't make sense to me. If you're a doctor and you're allowing insurance to dictate how you're going to take care of your patients, shame on you. That's just the way I feel about it. But again, a doctor can be trained in something but not be very good at it, or maybe they just don't have a lot of experience at it. And you might have a nutritionist who doesn't have a doctorate degree but is super sharp and super well experienced. So there's two ends of that. I would say if you're looking for somebody local and looking to find, look up those 3 resources I gave you earlier, and ask your friends or family or relatives, ask your neighbors, ask somebody around who maybe there's somebody in your area with really good experience, and who can get the job done for you. But it's just one of those things. You may go to a doctor who's got, even like my credentials. I've got 3 different sets of credentials. I mean, I'm a chiropractor, but I'm also a doctor of pastoral science, and I'm also a diplomate with the American Clinical Board of Nutrition. There may be people out there that have the exact same criteria that I do that just really don't practice in the same manner, don't do the same types of things, are not quite as thorough. Again, yet they hold the exact same degree and the exact same education. It's just one of those things. It's hard to, it can be hard to navigate. So sometimes asking people that you know for a referral is a good place to start. Okay. Let's see. Boy, it just looks like there's just too many questions again tonight, and I will, come back next Monday and we'll get them all answered. I just can't get through all of these. I'm going to take one more here. I've been tested for lactose sensitivity as well as celiac disease. Both came back negative. So what is the testing you recommend? Well, if you're talking about lactose, it's not lactose sensitivity, it's lactose intolerance. So I don't know if that's your words or if that's the words of your doctor, but if your doctor said they were testing you for lactose sensitivity, there's no such thing. There is lactose intolerance, and there's a big difference between a sensitivity and an intolerance. An intolerance is an inability to digest. A sensitivity is an immune response. So was the test a breath test where they gave you lactose and then had you breathe? That would be more specific. That would be a lactose intolerance test. If you've had, again, it just depends on how you were tested, because somebody says I've been tested for celiac disease. What does that typically mean? Traditionally, what that means is I've had a biopsy It means my doctor measured me for anti-gliadin antibodies and something called anti-tissue transglutaminase, and even potentially something called anti-endomysial antibodies. Those tests are notoriously bad in terms of delivering a false negative result, meaning you can have the test come back negative, but it doesn't mean that you're not gluten sensitive, meaning that's what false negative means. So the testing that if one of the tests I'm talking about, if you're talking about gluten sensitivity, and those of you who didn't watch the Gene Summit, the Dirty Gene Summit, which ended today or is ending today, the encore, the replay is today. But if you didn't hear my presentation, I talked all about the in-depth on gluten sensitivity and the genetics around gluten sensitivity and answered that question in great detail. But the simplest way to answer it is, look, if you haven't been genetically tested for gluten sensitivity, then you haven't been properly tested for gluten sensitivity, and any other test that you've had done could have been false negative and given you a result that is actually leading you down the wrong road. Okay. So, all right. Well, we've got so many more questions I just can't get to tonight, but I want to thank you all for tuning in. Now, before we wrap it up, I want to remind you all the Pick Dr. Osborne's Brain Show is on every Monday evening at 6 p.m. That is Central Standard Time. If you want to get reminders, you got to go up to Dr. Peter Osborne on Facebook and go up to the subscription panel up there and just click the button and hit allow notifications so that you get reminders when this actually goes live. And that way it'll ding your Facebook when we start. And that way you can tune in next time if you've got questions, or you can tune in every Monday night and get your questions answered. Those of you who found value in this, I would greatly, greatly appreciate it if you give me some love, hit the love and the like buttons, hit the share button, share it with a family member. Look, the more people we can get this information to, the more people we're going to be able to help in the world and make the world a better place. And I appreciate your help in that as much as you appreciate me taking my time to deliver this information in this format to you. So make sure you're liking, make sure you're sharing. We're going to see you again next Monday for another episode of Pick Dr. Osborne's Brain. Have a great week. Take care.